Normal intraoral anatomical landmarks of maxilla and mandible. Learning objectives. At the end of this class, the students will be able to identify and interpret the maxillary and mandibular anatomical landmark in intraoral radiographs. Understand and differentiate normal anatomical landmarks from pathologies. Introduction. The radiographic recognition of disease requires a sound knowledge of the radiographic appearance of normal structures. Intelligent diagnosis mandates an appreciation of the wide range of variation in the appearance of normal anatomic structures. Teeth and supporting structures. I. Enamel. B. Dentin. C. Pulp. Cervical burnout. Radiographs sometimes show diffuse radiolucent areas with ill-defined borders present in mesial and distal aspects of teeth in cervical region. These regions appear between the edge of the enamel cap and the crest of the alveolar ridge. It should not be confused with root caries. Supporting structures: lamina dura, alveolar crest, periodontal ligament space, cancellous bone. Lamina dura. It is a thin radio-opaque layer of dense bone surrounding the tooth socket. It is thicker than the surrounding trabecular bone, and thickness increases with increase in amount in the occlusal stress. Alveolar crest. The gingival margin of the alveolar process that extends between the teeth is apparent on radiographs as radiopaque line called alveolar crest. It is considered as normal if it is not greater than 1.5 millimeters from the CEJ of adjacent teeth. Periodontal ligament. Space. PDL space is primarily composed of collagen, so appears as radiolucent space between tooth root and lamina dura. Cancellous bone. It lies between the cortical plates in both the jaws. It is composed of thin radiopaque plates and rods, surrounding many small radiolucent marrow spaces.
Landmarks of maxilla. Intermaxillary suture nasal fossa. Nasal septum, nasal aperture, nose. Anterior nasal spine, incisive foramen. Superior foramina of the nasopalatine canal. Lateral fossa, nasolacrimal canal. Maxillary sinus, zygomatic process. And zygoma, nasolabial fold, pterygoid plates. Maxillary anterior region, nasal septum, nasal fossa. Nasal spine, incisive foramen. Nose median palatine suture. Intermaxillary suture, or median palatine suture, appears as a vertically oriented radiolucent line in true image projections through the midline. Usually prominent between the two central incisor roots in young individuals. Anterior nasal spine. Appears as a V-shaped radiopaque structure in the midline above the incisive foramen. Nasal aperture. The inferior border of the fossa aperture appears as a radiopaque line extending bilaterally away from the base of the anterior nasal spine. Nasal septum appears as a radio-opaque line that separates the two nasal fossa in the midline. Nasal fossa, apparent in the maxillary anterior periapical view as two radiolucent areas separated in the midline by the nasal septum. Nose. The soft tissue tip of the nose is frequently seen in projections of the maxillary central and lateral incisors, superimposed over the roots of these teeth. The image of the nose has a uniform, slightly opaque appearance with a sharp border. Incisive foramen anterior palatine fossa. Usually appears as a prominent radiolucent area above or between roots of two central incisors. It usually appears round or oval in shape and doesn't exceed 6 millimeters in diameter. Nasopalatine canal. The nasopalatine canal originates at two foramina in the floor of the nasal cavity. The openings are on each side of the nasal septum, close to the anteroinferior border of the nasal cavity, and each canal passes downward anteriorly and medially to unite with the canal from the other side in a common opening, the incisive nasopalatine foramen. Superior foramina of the nasopalatine canal. Superior foramina of the canal occasionally appear in projections of the maxillary incisors, especially when an exaggerated vertical angle is used. They are usually round or oval, although they may make various outlines, depending on the angle of projection. Maxillary canine region are floor of nasal fossa, maxillary sinus, lateral fossa, and nose, lateral fossa. The radiolucency results from a depression above and posterior to the lateral incisor. To help rule out a pathology, look for a lamina dura surrounding the adjacent bone. Nasolabial fold. Nasolabial soft tissue fold, arrows, extends across the canine premolar region. Nasolacrimal canal. The nasolacrimal canals are routinely seen on maxillary occlusal projections in the region of the molars. Occasionally, it can be visualized on periapical radiographs in the region above the apex of the canine, especially when steep vertical angulation is used. Maxillary molar region are maxillary sinus, zygoma, pterygoid plate, hamelar process, coronoid process, and maxillary tuberosity. Maxillary sinus. The maxillary sinus, with its thin bony walls, its thin mucosa, and its vast airspace, produce an extremely dark image deep to the maxillary teeth. Its outlines, particularly its floor, are clearly delineated by delicate radio-opaque lines. In general, the floor of the sinus is approximately coincidental with the location of the apices of the roots of the upper teeth, bicuspids, and first two molars. But there is often as much as 2 or even 3 millimeters of maxillary bone between the root ends and sinus floor. In other cases, the sinus floor dips so deeply between the roots of the maxillary teeth that the latter appear to project into it for as much as 1/2 of their length. Neurovascular canals. Thin radiolucent lines of uniform width are found within the image of the maxillary sinus. Shadows of neurovascular canals or grooves in the lateral sinus walls that accommodate the posterior superior alveolar vessels, their branches, and the accompanying superior alveolar nerves. A line of Ennis on periapical radiographs of the canine, the floors of the sinus and nasal cavity are often superimposed and may be seen crossing one another, forming an inverted Y in the area. Often one or several radiopaque lines traverse the image of the maxillary sinus, and these opaque lines are called septa. They are thin folds of cortical bone that project a few millimeters away from the floor and wall of the antrum, or they may extend across the sinus. Usually oriented vertically and vary in number, thickness, and length. Zygomatic process and zygoma U or J-shaped radio opacity, often superimposed over the roots of the molars, especially when using the bisecting angle technique. Maxillary tuberosity, rounded elevation located at the posterior aspect of both sides of the maxilla. Represents the end of maxilla, appears as a radio-opaque structure. Pterygoid plates. The medial and lateral pterygoid plates lie immediately posterior to the tuberosity of the maxilla, not apparent in many intraoral radiographs of the third molar area. When they are apparent, they almost always cast a single radiopaque homogeneous shadow without any evidence of trabeculation. Hamular process. It is a bony spine extending from pterygoid process of the sphenoid bone. Appears as a radio-opaque spine that is recorded on radiographs distal to the tuberosity of maxilla and extends downward. Moving on to landmarks of mandible. Landmarks of mandible are symphysis, genial tubercles, lingual foramen, mental ridge, mental fossa, mental foramen, mandibular canal, nutrient canal, mylohyoid ridge, submandibular gland fossa, external oblique ridge, inferior border of the mandible, and coronoid process. Symphysis. Radiographs of the region of the mandibular symphysis in infants demonstrate a radiolucent line through the midline of the jaw between the images of the forming deciduous central incisors. Fuses by the end of the first year of life, after which it is no longer radiographically apparent. Mandibular incisor region are mental fossa, mental ridge, genial tubercle, and lingual foramen, genial tubercles. They appear as radio-opaque circle that surrounds the lingual foramen just below the apices of the incisors. Lingual foramen, radiolucent hole in center of genial tubercles, usually surrounded by a radio-opaque structure. Lingual nutrient vessels pass through this foramen. Mental ridge, bony prominence found on the labial aspect of the mandible near its inferior border, and extended from the premolar region to the symphysis area, on which it takes an upward turn as it approaches it. It appears as a radio-opaque line below the apices of anterior teeth. Mental fossa represents the depression on the labial aspect of the mandible overlying the roots of the incisors. The resultant radiolucency may be mistaken for pathology. Mandibular premolar region are mental foramen, mandibular canal, mylohyoid ridge, and submandibular gland fossa. Mental foramen appears as a radiolucent, ill-defined area between the apices of bicuspids. Represents the anterior terminates of the mandibular canal. May be round, oblong, slit-like, or very irregular, and partially or completely corticated. This is CBCT images represents that opening of the mental canal is directed superiorly and posteriorly. Mandibular molar region are external oblique ridge, mylohyoid ridge, mandibular canal, and submandibular gland fossa. Mandibular canal arises at the mandibular foramen on the lingual side of the ramus and passes downward and forward, moving from the lingual side in the third molar region to the buccal side in the premolar region. Contains the inferior alveolar nerves and vessels. This images represents that bifid mandibular canal seen in CBCT. Submandibular gland fossa. Depression on the lingual aspect of the mandible on which submandibular glands are present. It appears as a zone of radiolucency below the lower molars. Mylohyoid ridge, also called the internal oblique ridge. Slightly irregular crest of bone on the lingual surface of the mandibular body. Extends from third molar area to second premolar region, placed below the external oblique ridge. External oblique ridge. Continuation of the anterior border of ramus passing downward and forward on the buccal side of the mandible. It appears as a radio-opaque line, which usually ends anteriorly in the area of the first molar. The external oblique ridge, red, and the mylohyoid ridge, blue, usually run parallel to each other, with the external oblique ridge always being higher on the film. Inferior border of the mandible. Occasionally, the inferior mandibular border is seen on periapical projections as a characteristically dense, broad radiopaque band of bone. Coronoid process appears as a triangular radiopacity, with its apex directed superiorly and anteriorly, superimposed on the region of the third molar, apparent on periapical radiographs of the maxillary molar region.